Hello, my name is Andy Owusu. I am the Mental Health Project Officer for the OFS Black Students Mental Health Project here at LSBU. So my job here is to sort of develop the support services we have to be more culturally competent and provide more culturally appropriate resources for our Black students. Our Black students make up about 25% of the school's population, and that isn't necessarily reflected in our well-being team. So when we have our Black students come in, they're more likely that overrepresented in our crisis referral pathways and less represented or underrepresented in our self-referral pathways. Give an explanation to the school as to why that is. Find the students, speak to the students, and ask them what they sort of, do to take care of their mental health. What we can do as a school, what facilities we can put in place, and what resources we can put in place to sort of help facilitate that journey to promoting good mental health within the Black community, and then co-creating those resources with our students. So providing resources that are created by our students for our students, and of course it's sort of approved by the wellbeing team and by other experts here and there. So essentially, we are creating sort of proactive and preventative intervention tools for our Black students to be able to use in regards to taking care of their mental health. So at the start, we wanted to speak to students to find out why. And the way we did that, we did this research projects first of all. So we did a mixed methods approach. We did qualitative and quantitative approaches. We did questionnaires, which we sent out to all of the Black demographic in the school, and then we did focus groups with over 80 students in focus groups. These focus groups went on for about an hour to 2 hours, an average of maybe an hour and a half. And then we have a semi-structured sort of set of questions that we help to guide our conversation. And it's basically to speak to the students to find out their experiences and their journey throughout education, with seeking support, with here at LSBU and their overall student journey, with mental health and with well-being. So how do they take care of themselves? What role does their family play? Does the school play? How do they sort of facilitate and navigate all these different facets? So that's the sort of the why, and then look at how many of them sort of interact with our schools support services that already exist, or how many of them even know about it. Get those numbers, establish the why, and then we look at the action of what we wanted to do. So speaking to the students to find out how can we then improve our services to be more appropriate for you. How do we make it feel like you are included in what we have, because currently it is not. That's why they brought this project in, and we got funded by the OFS to sort of create these interventions for our students. And then finding out the why then leads us to giving us sort of different avenues for us to create resources with our students, which would then use as tools. So the students more or less sort of direct as to where we needed to go in terms of what we've created and the events that we do. So in terms of events, we've done a lot of things which touch upon a lot of different groups. So predominantly we're working with our Black students, but even when you break that down, there are different pockets of groups within the Black community. At the start of the year, we did like an afternoon tea event, which was for our LGBTQ plus students and allies. For them to come, and the purpose of that was to sort of start building and developing community within our Black students and within members of that community, to sort of help them to identify each other. We even have members of staff coming in there, and just to help generate sort of that community of safeguarding community within the LSBU family sort of thing. And then we've done a whole bunch of other things in terms of resource creation with our regular students, set up resources, which is our students giving advice to other students basically, and then with us plugging in the LSBU resources that we have. And if we can't plug in LSBU resources for a specific topic, we find external resources. So someone like an organization that we're partnered with is Black River, and they specify in providing therapeutic services for Black people, so dealing with Black trauma and everything like that. This was developed post like George Floyd and post-COVID, to find a space that is there to cater for our Black students or for Black people who live in Lambeth and Southwark, which is like the neighbouring boroughs over here. So yeah, we've done quite a few different things. Yeah, of course. So we're hoping to sort of create a wealth of resources for our students to access, that they can use to sort of to use as a preventative tool, so that they don't end up in a point of crisis. So hopefully if they're going through something, we would have created something, some sort of resource that touches on a point that gives them advice that is practical and proactive, so that they can access that resource and help them to sort of get back from wherever they were in terms of like a stress point. And then if not, we also want to make them feel comfortable in reaching out to the team, because the team will have the appropriate way to address whatever issues that they're dealing with. Hence the culturally competent resources and the training that we will sort of be embarking within the wellbeing team and within the institution, and other things that we've done. We've changed how the school approaches wellbeing in terms of a wellbeing week. So usually when we started, usually you at Freshers Fair, you have like different stalls and people come and just give you leaflets with bits of information on it. As a fresher or as a new person in school, in the university, you collect it. Yes, you smile, you collect it. When you go home, how many of you actually read that kind of stuff? You just dash it in the bin, right? So we've changed the way wellbeing approaches that, which is we've now made sure we integrated or embedded the wellbeing lecture in the students' timetable at the start of the year. And then we get one of the wellbeing advisors or the DDS advisors to come and provide a lecture and present to the students all the information that they will need, all the information that they should be aware of going ahead in the year. And then we give them the PowerPoint slides as well, which they have access to on Moodle, so they can actually access it back and forth. So that's one thing that we've done in terms of changing how the institution approaches well-being for our students. And the next thing we're doing is we're starting a mentoring scheme, which is going to be headed by the SU. So we partnered up with the SU, and they'll be leading the project and expanding the mentoring program where students get paid, and they will get an accredited mentoring training, which will be, well, however they want to sort of break that up. But once you do that training, being accredited as a mentor, you go away with like a certificate and everything, and then you're embedded in a program which is going to be going on for 3 to 4 months, which is basically to help facilitate students, give them the role models, and help to facilitate a conversation around mental health and well-being. And that's what we're trying to do within the next couple of months, actually. So yeah, that's the next steps for the project. In terms of legacy-wise, we want to create something that will stick around for a while, that would allow students to sort of be able to, resources that our students will be able to reuse year after year after year, and is practical, is what we're trying to do, just to stock as much of that as possible and co-create it with our students. So we have students such as yourselves helping us to create resources for other students. That way it's just more relatable, rather than just the institution delivering something and just throwing it out there and then telling the students to absorb it, which sometimes doesn't always go down. So yeah, we're trying to jump over some barriers and lift some ceilings here and there.